I'm Dr. Kimberly Madison, a doctoral prepared nurse practitioner, and I'm the founder of Mahogany Dermatology, Nursing Education and Research, where we're committed to increasing access to dermatology nursing education, specifically when it comes to skin of color, business acumen, and digital fluency.
My name is Jade Trevino. I'm BSN Prepared Registered Nurse and the founder of Go Skin Check Mobile Dermatology Service, making it more convenient to access dermatology care in your home. Yeah, so nurses are already triaging in many areas of healthcare. As a matter of fact, in New Zealand and Australia, they have nurses called melanoma nurses, and these nurses work autonomously in the community and in clinics, and they are specially trained to assess and not diagnose, but assess and triage patients who have lesions or spots that are highly suspicious to be skin cancer or melanoma. And they have created this model of care in those places because they found a need and they were creative in figuring out how can we, number one, increase access to care, and number two, get the right patients in when they need to be seen at the time that they need to be seen. And so I think that that is a model that we can definitely adopt here, and one that I am actively working on bringing here to the United States. I believe in it so much. I just think that, there's even what we found in our research was there's a care model called task shifting. So there's a care model called task shifting, and that's where tasks that are usually handled by physicians are shifted to registered nurses. And so we've seen this in the United States with aesthetic medicine, where nurses are providing care for aesthetics like Botox and filler. And so the same model can actually be used with proper training to increase access to dermatology care.
Okay, I love this question. This is probably the best question. So nurses already are primarily positioned because I don't know if the public knows, but nursing owns the skin. No matter what setting you work in, particularly in the acute care setting, the skin is actually the nurse's job. The problem is that our training focuses on a very limited aspect of the skin. In fact, we don't even call it dermatology in nursing. We call it integumentary. And a lot of the focus is on incontinence and wound care, which aren't really that sexy. So you don't see a lot of nurses taking an interest in it. Although I think social media has played a huge role in bringing more attention to dermatology and aesthetics specifically. So if the nurse already owns the skin, how do we empower that nurse to recognize that their voice matters, their eyes and their ears, especially as the provider? I'm only with them for such a little bit of time. I need the nurse's input. So right now, nurses can do documentation with a little bit more education. The documentation can improve beyond red spots, right? Just like our patients. So certainly with their documentation, understanding their terminology. And then, because look, when we talk about our dermatologists and they're surgeons, right? I think their time is best utilized, especially if we're talking about resources that are limited, on your moderate to severe and rare cases. Your mild cases, some of those patients are taking care of that at home. That's a great place for a nurse to provide education. This is what we have. These are the drugs that we have available. These are the side effects. I trust this one. I've seen it used many times. It works really well, but you do have to be mindful of X, Y, and Z. Or, hey, look, this is what you should look for when you're looking for a provider. I can provide you education. I can tell you who's available. I can tell you where to go look, how to prepare for that visit. I can educate you how to use AI to prepare for that visit. You brought some papers in. I'm going to teach you what is accurate, what is not, and how you can identify that for yourself. For my NPs who are out there who don't have dermatology education, our training teaches us how to handle mild and even moderate cases. And if you keep showing up and you're educating yourself, you're attending conference, you're reading Derm Times, every day you show up, you're going to continue to learn. So maybe you start off treating those mild cases, which might be with oral or topical treatments. And you can stay there forever, and you can just help get someone on a treatment while they're waiting that 6 to 8 week appointment. Or as you continue education, you can advance into taking more moderate cases, and with proper mentorship, maybe you start to feel more comfortable taking care of severe cases over the course of time. So it's already happening. And with the guy I mentioned, the nurse in Nigeria, Obe Ezekiel, he's the founder of AfriDam AI. He's a nurse. So what he did is he built a platform where you come on, you take a picture of your skin, And that's the 40,000 images that it was trained on, diverse skin tones. It gives you an idea of what might be the problem. And immediately the whole mission is to connect you to a dermatologist. That's a nurse doing that. That's a nurse helping triage, decrease wait times, and get you access to a dermatologist who is the most educated when it comes to dermatology. So that's how nurses can help triage and help patients get care much faster from people who are properly trained, and how nurses can play a big role in that.